next. September is National Suicide Prevention Awareness Month. Today, University of Houston is hosting its annual End the Stigma event to raise awareness for mental health on campus. Joining me now is Dr. Robin Gearing and student and mental health advocate Tyler Luke. Good morning to you both. Thank you so much for your time this morning. We appreciate it.
Thank you.
For people not familiar with End the Stigma, what is it? And tell us all about the event.
Right, so End the Stigma is a yearly event that the Student Government Association of the University of Houston puts up in honor of those college students who die by suicide every year. The statistic is 1,100 students who die on college campuses every year of suicide, and these shirts, the number of shirts represents that.
And with that, this just paints the picture on how critical it is to have conversations like this when it comes to mental health within colleges across the country. Talk to us about the different resources available to college students.
So colleges have counseling, psychological services. University of Houston, we have a lot of services for students. Students who are in relationships, students who are in crisis, who need to talk, who need psychiatric care, or just, focused 1-hour sessions, short-term therapy, long-term therapy. And our CAP Center also does referrals to mental health resources surrounding the campus. So that's what students have.
Tyler, what inspired you to get involved as an advocate for your fellow students?
What inspired me towards advocacy was the fact that my brother died of suicide almost 4 years ago now, so I have a very personal connection with it.
Well, I'm sorry to hear that. I'm glad to see that you're doing work that is so meaningful and making a difference in other people's lives. Tyler, we do appreciate it. Dr. Gearing, I would like to talk to you about Cougs Care and how this helps students.
The University of Houston has been very proactive in trying to address this. Suicide is an issue that affects all of us in the U.S. It affects all of us in college campuses. 54% of Americans know someone who has died by suicide. And interestingly, 25% of Americans don't have someone they can confide in. So in colleges, and specifically at the University of Houston, Cougs Care really tries to develop a number of opportunities where people can come together, feel safe, talk about their experiences. As Tyler mentioned, we have a number of programs, Stop the Stigma. We have a very in-depth and thoughtful CAPS program, which is counseling and psychological services, that makes itself available for students and staff and faculty. The idea is to destigmatize the issue of suicide. It is a human experience, and the more that we can talk with people, be open and understanding that this is a thought that people might have at different points of crisis in their lives, but it's a thought that it is addressable. 94% of Americans believe that suicide is something that we can fully prevent. With zero suicide initiatives across the country, many of us in focus in the field believe that suicide is something that we ought to be really focusing on. But it starts with events like this. It starts with people coming out. It starts with family members like Tyler, who show great courage in saying this is a normal human experience. It shouldn't be stigmatized. If all individuals can have these open conversations, can ask someone, how you feeling today? Are you okay? I'm a little worried. There are resources, whether it's at the college through the CAPS program or the Cougs program, or it's on 988, which is a nationwide text or phone line. There's opportunities to help, but it often comes down to just being human, listening, talking, and working, and recognizing that this is not something to be stigmatized. It's just something to recognize as a very human issue.
We're going to be talking a little more about those resources in just a moment, but for now, thank you for being intentional in creating this space to help others. Dr. Gearing and Tyler Luke, thank you so much for your time this morning.